Definition of the fibromyalgia. Fibromyalgia is characterized by widespread musculoskeletal pain associated with fatigue, sleep memory and mood disturbance. السيمتومز ممكن نلخصها في 3 عناوين رئيسية: widespread pain, fatigue, cognitive changes أو difficulties. widespread pain الكاركتر بتاعه constant dull ache lasted for at least 3 months. Pain must occur on both sides of the body and above and below the waist. People with fibromyalgia often awaken tired in spite of they report sleep for long periods, affect the ability to focus, pay attention and concentrate. Fibromyalgia often associated with other conditions such as chronic fatigue syndrome, migraine and other types of headache, temporomandibular joint disorder, anxiety, interstitial cystitis, or painful bladder syndrome, irritable bowel syndrome، وممكن تبقى coincidental مع ال incidence of depression. الكوزس: repeated nerve stimulation causes the brain and spinal cord to change، أو بمعنى آخر causes the brain and spinal cord to be sensitized. These changes involves an abnormal increase in level of the certain neurotransmitters that signal pain. The brain pain receptors seems to develop a sort of memory of the pain and become sensitized. زي ما يكون بيكون جوه البرين finger print للبين. الفاكتورز اللي تؤدي إلى these changes include genetics. Fibromyalgia tends to run in families. Infection. Some illness appear to trigger or aggravate fibromyalgia. Physical or emotional events sometimes can be triggered by a physical event such as car accident. Prolonged psychological risk factors for developing fibromyalgia includes women more than men, first degree relatives that has a condition, osteoarthritis, rheumatoid arthritis, systemic lobe. complication زي ما قلنا قبل كده affecting the ability to function and work, depression و health related anxiety. الdiagnosis: in the past 18 specific tender points must be tender. الحقيقة بقى newer guidelines from the American College of Rheumatology don't require a tender point exam. Instead, the main factor needed for fibromyalgia diagnosis is widespread pain throughout your body for at least 3 months. يعني الديستريبيوشن عادة بيبقى واخد الليفت upper region, right upper region, left lower and right lower و axial region زي ما قلنا قبل كده ان هو must be distributed above and below the waist and right and left side of our bodies. ايه اللاب انفستيجيشنز اللي ممكن نستخدمها في الدياجنوزس اوف fibromyalgia؟ اول حاجه exclude other conditions that may have similar symptoms. عشان كده بنعمل complete blood picture, ESR, rheumatoid factor, thyroid function, anti-nuclear antibody, vitamin D. management of fibromyalgia: اول حاجه الميديكيشن، البين ريليفر، الانالجيزيا العادية الاسيتامينوفين، الإيبوبروفين، الانتي ديبريسنت commonly used اللي هو الدولوكسيتين، موجود منه السيمبالتا والسيمباتكس. ده may help ease the pain and fatigue associated with fibromyalgia. الانتي كونفالسنت اللي هو including ال commonly used الجابابنتين helpful in reducing fibromyalgia symptoms, while pregabalin was the first drug approved by FDA to treat fibromyalgia. The other modalities of therapies اللي هو الادجuvant therapy للميديكيشن، physical therapy، occupational therapy، counseling، massaging therapy. أهم طريقة للمانجمنت of fibromyalgia اللي هي changing the lifestyle of the patient.